Alcohol use disorder, AUD, is characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. It is a spectrum disorder and can be mild, moderate, or severe, and encompasses the conditions that some people refer to as alcohol abuse, alcohol dependence, or the colloquial term alcoholism. AUD can cause lasting changes to the brain that make patients vulnerable to relapse. The good news is that no matter how severe the problem may seem, most people with AUD can benefit from treatment with behavioral therapies, medications, or both. Hi, it is February 8th, 2004. It's 6 o'clock at night, and as of 10:30 this morning, I was officially 10 days sober. Um, Yesterday, I didn't have a lot of shaking, and this morning when I woke up, I didn't. And then I exercised, and then after that, then I was really shaky. And that's the same way the other times that I got really shaky was after exercise. So I don't know if there is, I mean, I know I'm not supposed to be stressing the body or anything, but anyway, I don't know if it's caused from the exercise or not. Um, I still have a problem regulating temperature, and like stutter. I've been stuttering a lot. So, but I won't reset or do anything like that because I want you to see the real effects that alcohol does to the brain when you can't think and you stutter and you shake. And because these are all real things, they're all real consequences of having alcohol in general. Like any alcohol is poison. But anyway, I digress. Today, I want to talk about my sister a little bit more because a lot of people who have AUD, you would never know. And as you saw in the beginning, that people with this disorder, um, they um, they will drink anyway, even if occupational hazards or consequences, or because they have to drink. And anyway, so that definition was in the beginning of what alcohol use disorder, or AUD, as I'll refer it to throughout the rest of the video. So anyway, okay, so today was 61 degrees out, which is crazy. February 8th, 61 degrees. We had rain come down for a little bit. But anyway, all right, now let's get started. Okay, so this is all this information I got from my sister's LinkedIn profile. And I want to show you how successful she was. Okay. And the whole time, just remember, she had severe AUD. Okay. Severe. Okay. And she died from it. All right, let's go. Okay. So her bout was she was experienced independent contractor with a demonstrated history of working in the mental health care industry, skilled in stress management, staff development, and nonprofit organizations. Strong background in a variety of healthcare settings with a doctorate in psychology, focused on clinical psychology, specialized trauma, and identity concerns from Illinois School of Professional Psychology, Chicago campus. Okay, so she started off at the University of Iowa, where she obtained her bachelor's degree in anthropology, and that was Iowa City, Iowa. Duh, right? Okay. And she attended there from 1998 to 2002. Her GPA was 3.4. Her activities and societies included women's rugby team, honored All American Collegiate Scholar. Uh, she was recognized on the National Dean's List in the year 2000 and also in the year 1999. And she minored in women's studies. In 2001, she she took a semester abroad and she went to Louvain University of Lundberg, I hope I did my umlaut right. Das ist sehr gut, yeah. She got she didn't get a degree there because she was just doing a semester there, but she studied advanced German language studies in Nuremberg, Germany. Like I said, 2001. Activities and societies, intensive German language studies. Lived abroad for 6 months while to taking intensive language courses equivalent to 4 university semesters of German. You see that stutter? Like, that stuttering has been like this since I quit drinking. I never had a stutter. Okay. Illinois School of Professional Psychology, Chicago campus. She got her Master's of Arts, her MA, in clinical psychology at Chicago, Illinois. And that was in 2006 to 2008. Her GPA was 3.7. Then she stayed at that school, and then she got her doctorate of psychology in clinical psychology, and that was in 2008 to 2012. Her GPA was 3.9. Her activities and societies included APA accredited program, and her dissertation was accepting gender change, using the grief cycle to examine the experiences of family members of transgendered individuals. Okay. And here's her experiences. Okay. So this was, okay, in 2007, she was at the mental health, she was a mental health counseling extern at the Illinois Institute of Art. She did individual psychotherapy with students coping with crisis relationships concerns, substance abuse use problems, fear, anger, stress, illness, depression, eating disorders, self-esteem. In addition, she participated in a team responsible for educational programming, advocacy, and crisis. Okay. In 2009 to 2010, so for a year and a month, then she did she was a diagnostic extern at St. Joseph Hospital Resurrection Health Care at Diamond Head Care Headache Clinic. Okay, let me say it again. St. Joseph Hospital Resurrection Healthcare at Diamond Headache Clinic. There we go. It's in Chicago, Illinois. Okay. She conducted psychometric test batteries and intake assessments on children and adult inpatients suffering from chronic headache pain with high rates of comorbid psychopathy, stress-related somatic issues, and substance abuse. Okay. Provided feedback and treatment recommendations to inpatients on the unit. Participated in weekly multidisciplinary staff meetings with a team of clinic physicians, pharmacologists, psychiatrists, psychologists, and physical therapists about individual patient care and treatment goals. She facilitated a weekly alternative treatments to headache plan. She had a group with inpatients on the unit with focus on effective alternatives to pain medicines such as biofeedback, psychoeducation, relaxation, training, meditation techniques, and psychotherapy. She attended weekly didactic meetings on a variety of topics, including Axis 1 and 2 diagnostics, psychopharmacology, biofeedback, child and adult sexual abuse and trauma, prescription overuse, substance abuse, and alternative treatments for chronic pain management. Okay. So these are all the psychological tests administered. I'll just put them there real fast. You can look at that. So I don't have to read them all. Okay, cool. Cool. You can pause it if you need to read more. Okay, let's go on. All right. So then she did advanced therapy. She was an advanced therapy extern at DePaul University Counseling Services at Chicago, Illinois, and that was from 2010 to 2011 for 11 months. She conducted weekly intakes and maintained an active caseload of 12 to 14 individual clients per week from various multicultural backgrounds ranging in age, program of study, socioeconomic status, race, sexuality, and gender. She co-facilitated a weekly 1.5 hour general therapy group and performed time-limited orientated psychotherapy. She provided walk-in crisis coverage and made appropriate referrals for students and or assist them with a crisis plan. She actively participated in university outreach, including managing exam stress, anxiety, depression, and residential housing concerns. Okay. She attended weekly didactic meetings which cover a variety of topics pertaining to college counseling with strong consideration to trauma, multiculturalism, and integrated theory, practice, and ourselves. Okay. Then she did member relations at American Hospital Association, and that's in Chicago. And that was in 2006 to 2011 for 5 years and 7 months. She did this. Okay. She contacted member hospitals on behalf of the American Hospital Association to discuss principal challenges hospitals face, particularly in regards to the American Hospital Association's federal advocacy work. She aided with editorial work for national publications distributed by the American Hospital Association, contacted member hospitals on behalf of the American Hospital Association to discuss principal challenges hospitals face, particularly in regards to the American Hospital Association's federal advocacy work. Aided with editorial work for national publications distributed by the American Hospital Association. And then she did her pre-doctoral intern at Johns Hopkins University. It's pretty good. Baltimore, Maryland, and that was from 2011 to 2012. That was 1 year and 1 month she did that. So she conducted 3 to 4 regularly scheduled intake evaluations per week and managed an active caseload of 60 plus clients for brief and longer term individual couples and group therapy. Okay. Clinical population consisted of undergraduate, graduate, and international students from Johns Hopkins and the Peabody Institute. They varied in age, gender, ethnicity, religion, sexual orientation, race, and socioeconomic status. Presenting issues included Axis 1 and Axis 2 difficulties, eating disorders, learning disabilities, suicidal ideation, and she saved me, okay, when I was young, when we were younger, whatever. Substance abuse, gender and sexual identity development. And if you heard yesterday, or if you know me, then you know that my sister was a lesbian. Substance abuse, gender and sexuality identity development, stress management, testing anxiety, interpersonal difficulties, loss and trauma, and social and cultural adjustment. She utilized the Counseling Center suicide tracking system to monitor students endorsing suicidal thoughts and behaviors. So, yeah. She provided daytime and after-hour on-call crisis intervention and consultation for students requiring immediate clinical attention. Duties involved conducting evaluations, determining the urgency of the client's case, and developing a treatment plan. She participated in peer supervision and provided case consultation with both interns and staff during weekly case management meetings. She was a member of the Johns Hopkins LGBT Resource Center Committee. The committee is dedicated to identifying and advocating for the needs of LGBTQ students and professionals affiliated with the university. She worked closely with the Dean of Students' Life and members of the Diverse Sexuality and Gender Alliance, the DSAGA, on implementing a safe zone program on campus. She actively participated in outreach programming, which involved reaching out to a range of university departments and student organizations. She attended weekly didactic meetings on a variety of topics, including suicide prevention, substance abuse, psychopharmacology, psychological therapy and practice, sexual identity development, treatment of diverse populations, ethical principles, in conduct and professional development. And then, um, so this is what she did when she had passed. And she had done this for 11 years and 2 months from 2013 to the time she passed. She was an independent mental health contractor at for Spectrum Behavioral Health, and that's in Annapolis, Arnold, and Crofton, Maryland. Okay. And that, like I said, 2013 to, so 11 years and 2 years. Okay, 11 years and 2 months she worked. Okay, anyway. So she worked with teens and adults coping with a wide range of psychological ailments and concerns, including anxiety, attachment, dependency, depression, bipolar disorder, eating disorders, sexual assault, intervention, crisis management, suicide ideation and behaviors, substance use/abuse, pain management, interpersonal difficulties, loss and trauma, academic stress and dissatisfaction, and social and cultural adjustment. I also engage in couples therapy and lead process oriented therapy groups. She was into causes such as animal welfare, arts and culture, civil rights and social action, health, human rights, and politics. Now, does that sound like somebody who's an alcoholic to you? Yeah, no. And in fact, my whole family is riddled with AUD. Like, when people say alcoholism runs in the family, you really don't think it's like the way it is. You think, oh, somebody like maybe uncles. Like, it doesn't feel like it's immediate. It doesn't feel like it's concerning you, and it doesn't feel like it's something that you have to be careful about. It's like, just stay away from alcohol, I guess. But AUD, like, it changes your brain, and like it becomes a real problem, and people cannot. It makes it very, very. I mean, not that they cannot quit, but of course they can. But it's very, very difficult to do so. And like I said, I'm fortunate because I got to take time to recover, but a lot of people don't get that time. Um, and it's sad because I've taken 10 days and I'm still stuttering. I mean, I still got issues. If I had to face the world like this, I don't know if I could. You see, so if I didn't have this time, would I ever quit drinking? No, not until I either had to, because of, it becomes real serious with my health, which which it did really. I mean, like I said, I'm not done. I'm not out of the woods with a lot of stuff yet because I did so much damage. But anyway, it's just crazy. But see, and also forgetfulness. That's another thing with coming, like, off of alcohol. It's like it's hard to think your thoughts sometimes all the way through, and I don't usually have a problem like that. But anyway, so yeah. Anyway, the elephant in the room. Okay, so that is, a metaphorical expression for, the topic that that's a problem, or that's, you know needs to be talked about, but nobody wants to talk about it because it makes them uncomfortable, or it hits too close to home, or it's just, you know what I mean? Okay, so that's what that is. And that's so my family, because that's such an elephant in the room. Because, let's see, I have an uncle who he had an accident with, he had a blood alcohol of 0.20, and there was a car that stalled on the side of the road. They had their hazard lights on, and they were getting to the side of the road, but there was two people that were pushing it, and there was somebody that was steering it, and there was a baby in the back seat. And so my uncle hit him, and the two people that were pushing him, then he killed them. And yeah, maybe anyway, we'll talk about that another time. But anyway, so I have an uncle who went to prison for, drinking vehicular manslaughter. And then I have another uncle And these are both on my mom's side of the family. So there's six of them. Okay. Then my other uncle, he, I mean, I'll have to look and do research on it because I don't know if I believe anything anyone tells me ever because, people lie. So I don't know, but he spent 5 years in prison, in North Liberty. I know that. And I was told that it was for like DUIs, but I don't know how you could spend 5 years unless something serious happened. You know what I mean? And my family's really good about hiding stuff like that. And anyway, again, another story, a story for another time. But anyway, and then there's that. And then there's like me. I didn't think I had a problem. I have 3 DUIs. I've been to jail. You know. Uh, anyway, all that, and also I have 2 blood clotting disorders. Okay, and it's not good for me to drink. I know. I shouldn't drink. Right? Why? Why would I drink? See, and that's what AUD is. It's like, despite you knowing that you absolutely shouldn't, Liesel had Crohn's. And the funniest thing is, like, the whole time here she is, like, working with like substance abuse, and like, it's when I said yesterday that I felt like she was trying to help herself. She definitely was. I mean, she was trying to save herself. It's just so sad. And and look how functioning she was. That's the scariest thing, is how functioning they are. And so, like, my uncle, who had that it sounds high, but he was a severe alcoholic as well. And when you're a severe alcoholic, you function like that. In fact, when you don't have it, you don't. You have to have it. So it's kind of sucks. But anyways, I hope that you never touch alcohol if you've never touched it ever. It's straight poison. It's ethanol. So tomorrow I want to talk about rethinking drinking. I got to work tomorrow, so I don't know how much time I'll be able to spend on it. So it probably won't maybe go out tomorrow, but I don't know. We'll see. But that's the next topic I want to talk about, is rethinking drinking. If you saw the slide in the beginning, there were the drink equivalences, what beer equals versus, like, these are the same, or you know anyway, so that way you can see, like, when people because when people pour you a glass of wine at the restaurant, they pour it like there, that's actually like 2 drinks. you know so it's good to know what your equivalence is. And did you know that um, women are not supposed to drink more than 1 alcoholic beverage a day, and for men it's 2? And if you consume, I can't remember now, I'm not going to say now, because like I said, I'll do it tomorrow when I make sure I have the facts right in front of me. But that fact is true about the 1 for women a day and the 2 for men a day. So, but I say none. Don't ever touch it. Why? It doesn't do any benefit. And everyone said, or not everyone, well, I think everyone does actually say it. They're like, well, wine's good for you. It's good for your blood. Yeah. Well, it also does a lot of bad things to you. So it's good for your blood, okay. But what else is it doing? See, they're lying to you. I feel like there's a conspiracy going on. I feel like, especially because some of the information that I looked up, it was a, um, it's basically like, it gives like the facts, but it was so watered down compared to what you would see. Okay, well, we'll talk about that tomorrow, because again, I'm losing my thought because it's really hard to think um, right now because of withdrawal. So I don't know how long these symptoms will last, like I said, and they could last a while. Up to, I hope no more than a month, but I mean, it could last a month, but sometimes it lasts longer, and sometimes it's permanent. You just don't know. You messed up your brain. See, alcohol can get through the blood brain barrier, so that's not good at all. And yeah, all the effects that alcohol does. Yeah, we're gonna talk about it. We're gonna talk about it tomorrow. So, anyways, I just wanted to show an example of somebody who was had severe AUD, and she died as a result. And that is a sad life gone. So if you are drinking, I hope you consider stopping. Join me. Join me. Bye. Psych. It's getting dark out, and I took all my lights down that I had up earlier when I was filming. So, but I wanted to quick because I forgot to mention about Liesel's volunteering services. So, her volunteer work that she was very passionate about. She was a member and former vice president of the junior board of Heartland Alliance, and that was from 2005 to 2011. That's for 6 years and 7 months in the human rights. She actively participated in community outreach and volunteer work that supports Heartland's mission, which is to advance human rights and respond to the needs of endangered populations. Members of the Executive Committee for Art Against AIDS in 2008, the committee was responsible for organizing and managing all aspects of the fundraising event. In addition, I was the art chair. She was, this was from her, so this was what she had wrote. So anyway, she was she was the art chair and curator for Art Against AIDS in 2007 and 2008. As art chair, her primary responsibility was to solicit quality artwork from local and national artists, actively participated in community outreach and volunteer work that supports Heartland's mission, which is to advance human rights and to respond to the needs of endangered populations. Member of the Executive Committee for Art Against AIDS. Okay, so yeah, okay. So it doubled. I'm sorry. All right. So, okay. And then another thing she was very passionate about was the crisis call front. She was a crisis call frontliner for the National Runway Safe Line. And that was for social services. And she did that from 2010 to 2011 for 11 months. She was certified in crisis intervention training facilitated by the National Runway Switchboard. She managed crisis calls from a diverse group of youth, parents, guardians, and educators from all over the United States and Canada. Provided callers with support, information, and resources in addition to being a liaison between callers and social services protection agencies. So anyways, I needed to add that because that was what she was very passionate about. So anyway, okay, I'm gonna finish editing this video and get it up maybe tonight. Hopefully tonight. Yes, tonight. Okay. Bye.